What can Neolithic burials tell us about diseases in the Neolithic? Have you ever wondered what ancient burial practices can reveal about the health of people from the Neolithic period? This fascinating time, spanning from around 10,000 to 4,000 years ago, saw humans transition from nomadic lifestyles to settled agricultural communities. This shift likely influenced the types of diseases that affected these populations. Neolithic burials offer a unique perspective on health conditions during this era. As people began to establish permanent settlements, they created cemeteries and adopted more complex burial customs. These practices varied across cultures, but many included personal items buried with the deceased. The skeletal remains discovered in these burials can show signs of diseases, although interpreting these signs requires careful examination. For instance, some skeletal remains from Neolithic sites display lesions that suggest chronic respiratory diseases. These could be linked to tuberculosis or similar infections. However, it is important to note that only a small percentage of tuberculosis cases result in detectable bone lesions, making diagnosis tricky. Additionally, non-tuberculous mycobacterial infections can cause similar skeletal changes, complicating the identification of tuberculosis based solely on skeletal evidence. Another disease found in Neolithic skeletons is rickets, which is caused by vitamin D deficiency. A notable case from the Scottish island of Tiree revealed the earliest instance of rickets in the United Kingdom, showing that vitamin D deficiency was not just a problem in urban areas. Recent archaeological discoveries have even identified ancient cases of Yersinia pestis, the bacteria responsible for the plague, in Neolithic remains. However, these findings do not necessarily indicate that widespread outbreaks occurred during this period. By analyzing Neolithic burials, researchers can gain a better understanding of the health conditions of ancient populations. Examining skeletal remains and burial practices allows for inferences about the presence of certain diseases and their impact on communities. However, it is essential to consider the limitations of skeletal evidence, as many diseases do not leave visible signs on bones. From an archaeological standpoint, studying Neolithic burials not only reveals past health conditions, but also helps reconstruct the social and cultural practices of the time. The presence of diseases can influence how communities cared for their sick members and managed health risks within their settlements. So, the next time you think about Neolithic burials, remember that they hold clues to the health challenges faced by our ancestors.